So I think that we can then start. Welcome to all of you. I can see that there are very many people connected to our last webinar of this series on environment and health tools. This webinar is organized by the Regions for Health Network and by the European Center for Environment and Health in Bonn. The idea of having this series of webinars actually came about a year ago under suggestions of the audience of a workshop that we organized in Stockholm at conference. And there was the request to know more about tools which are available, developed by WHO and partners, on supporting policies, policy making at the national and also at the national level of governance. And so this is why we had these webinars, which are, I have to say, very much appreciated by many people. I have to say that I received a lot of feedback, and I don't want to take credit for that, because credit goes to our great speakers that we have in Bonn. We are very happy that we managed to organize these webinars, and I just wanted to say before introducing the speaker of today that last week there was the RHN workshop during the European Public Health Conference in Ljubljana. We organized that again together with the Bonn office, and the topic was air pollution. You might remember that we had a webinar on AirQ+, which is the specific tool to measure air pollution. We had this workshop in Ljubljana with Dorota Jarozinska there, and also with 4 panelists from Regions for Health Network. We had North Rhine-Westphalia, we had Moscow metropolitan area, we had Murska Sobota from Slovenia, and we had Flanders. And during that workshop, also one of the most recent documents released by the Bonn office was presented, which are the guidelines on noise. And I think that there was a strong interest in the audience and interest to have another webinar, so an additional one, which was not foreseen at the beginning because we already foresaw 6 webinars and this is the last one. But given that there was interest in having more information about these noise guidelines, I think that we will have an additional webinar next year in the first month. And if you are in agreement and you would like to have this webinar, if you can use the chat of this current webinar to say whether you would like to have this additional meeting where we would have Dorota Jarozinska explain more about the noise guidelines. The noise guidelines were picked up by many international media. They made literally a lot of noise. It's a very important topic, and if you want to know more, please let me know through the chat of this webinar that you would like to have also this additional webinar, and we will plan it for you in the first month of next year. Just as some housekeeping information, you are all muted in order to reduce the background noise. The webinar is being recorded and will be posted on YouTube, the RHN channel, as all the previous ones. Once you hear the speaker today, please mark down your questions and write them in the chat. And the chat is visible to everyone, so please use that function so that the chat can be visible to everyone. And I will collect the questions and direct them to the speaker at the end of the presentation. So 2 things for you while you are also speaking, you are also listening to the speaker. Please let me know if you want to have this webinar on noise, and think already for the questions for our speaker. Our speaker today, but I see that maybe there will be 2 speakers today. But I first introduce the first one, who is Marco Martuzzi, program manager of the World Health Organization at the European Center for Environment and Health, the WHO Bonn office, program manager for environment and health impact assessment. He will speak about what health impact assessment is. And I can tell you, Marco, that yesterday when I circulated the email, do you want to know more about health impact assessment? Many people said, yes, we want. Because I guess that this is increasingly becoming a buzzword. I mean, it was already a buzzword. It has always been probably. But now more than ever, so we need to know more about it and how to run health impact assessment, what are the tools available for that, and if you can also give some practical examples of how it has been used. I guess that I will give the floor to you, and just as a reminder, then we will have ample time in the end for questions and answers. Think of your questions already and write them through the chat. Marco, the floor is yours.
Okay. Thank you very much, Francesco. Good morning to everybody, and thank you very much for joining us for this webinar. Myself and Giulia Novacki are very glad to be able to share with you some overview of our work in health impact assessment, notably in environment and health impact assessment. It's a short time, so the topic is large. I'm very glad to hear the result of interest. We'll do our best to give you a flavor of our work here in WHO and hopefully stimulate you to do further, to look more into HIA, because it's a really powerful way to address health and its determinants. So we speak from the European Center for Environment and Health, part of the WHO European region in Bonn. Sorry, I think... the mouse. You need to use the mouse. Okay, I need to... Yes. We work, as I said, on environment and health. As you know, many factors in the environmental domain affect human health. This is a collection of the most important. You see a certain emphasis in this slide on risk factors. This is kind of the traditional environment and health domain, a collection of many risk factors. Some of them are very well known, like air pollution, which very large impacts, others are less known. But besides the risk factors, there's also, in recent years, quite an emphasis on broader determinants. This is the list of the current priorities in environment and health agreed by the 53 member states of WHO Europe in the 6th Ministerial Conference on Environment and Health from last year. You see air quality, water and sanitation, chemicals, waste and contaminated sites, climate change, action at city and regional level on environmental determinants, and the sustainability of health systems. So this is, you see, a mix of risk factors and sectoral type of big families of determinants. And of course, in the background, or in the foreground of all of this, we are clearly very much committed to the 2030 Sustainable Development Agenda. So there's really a need in environment and health to consider a broad version of the environment, not only the physical environment, strictly speaking, but also the broadest natural, social, and behavioral environment, in order to address those complicated determinants, and at the same time to adopt a very broad and comprehensive definition of human health, in line with WHO's definition of health from the 1940s, which talks about a complete state of well-being and not only the absence of disease. So this is the context into which environment and health impact assessment, the way we try to do it, take place. It's a challenging one, and we thought that we use an example to show, rather, it's a bit hypothetical, but to show how to proceed about a health impact assessment. Consider, for example, you saw in the Ostrava priorities, waste and contaminated sites as one of the areas, and consider a situation where a new incinerator or a landfill, some waste processing facility is proposed and planned in a certain region, in your region, for example, people from RHN can imagine that. And the HIA sets out to assess the health impact of the predicted health impact of this facility. So typically you collect information and data on the design of the plant, what it's going to be like, its emissions, and you do some modeling work on possible dispersion and persistence of the polluting agents. You review and collect evidence on the relevant health risks involved. You study and model and assess the likely human exposures to these agents. As you know, also from previous webinars, you need also to know about the background disease and mortality rates. And with all this information, you essentially estimate an attributable risk. You estimate how much the risk will change, or typically increase, and how many further events of various outcome will be predicted. Sorry, I have a box here. You can do this by population subgroups and also do some work to characterize the uncertainty around these estimates of, and these are your impacts. You can combine these different risks and impact in burden of disease. And in many cases, and we have quite an interest in that area too, you can also derive economic costs, the estimate of the economic costs of those impacts. So this kind of very simplified and schematic sequence, for the sake of this webinar, it's difficult to there's no sort of fixed definition and vocabulary on this, but we call this kind of procedure analytical HIA, where you need, of course, quite a bit of expertise and multidisciplinary expertise, in fact, to go through this kind of sequence. So in this case of a new incinerator or landfill, you start maybe looking at emissions in the air, and typically PM2.5 is often chosen as a good indicator of air emissions. You can from that derive mortality estimates, and this is what you saw in the webinar on RQ+. It's a very established methodology. You can also derive estimates of impacts on morbidity outcomes, and you can combine things into burden of disease expressed in disability-adjusted life years, or, as I said, also possibly in monitoring units. From here, you can go further and add several other elements, like, for example, emissions of certain specific pollutants for a waste processing plant, which will add, you see, the burden of disease will have an extra contribution to. You can consider, for example, the contribution to ozone, which add another bit of burden of disease. And you can consider other types of emissions, like in water, and there will be leachates, maybe by microbiological contaminants, and other specific contaminants like PFAS chemicals. And all of these will add a little bit of burden of disease. This is hypothetical. Of course, the dimension of those graphically represented burdens is not in proportion, but this is to give you an idea on how to proceed. And the thing continues. You have to consider emissions to the soil and to the food chain, which is a possibility, and different agents will add different impacts and different effects. So the burden disease increases while as you take into account the various contributions. Now, there's also more health relevant aspects include softer effects like the annoyance from odor, which is very commonly complained about, or the damage to the landscape, and these things affect well-being and produce stress. In some cases, it has been documented, and they can also interfere with the property value and market, and maybe also local violence type of patterns. And all of these things continue to add to the burden of disease. A new facility will attract more transport of waste being taken to the place. So locally there will be more emissions from transport, more road injuries, more noise, and again adding to the burden of disease. Land use will be affected, and maybe green space will decrease. Will be less access to green space, and there will be maybe less opportunities for physical activities. And there will be some sort of mediated indirect effects through contributions to climate change, emissions, and sustainability, adding yet another level of impact. Then there are unknown impacts that will probably take place, and we don't know about them, adding probably another bit of burden of disease. So this picture is a rather complex one. Health impact assessment is also very concerned about positive effects. A new plant like this will probably produce less waste around, less casual waste dumping, maybe some local heating that produce some jobs. So all these negative impacts, I focus on negatives for the sake of the argument, will probably be also accompanied by some positive ones. So this burden of disease actually might be overestimated if we consider positive effects as well. In any case, this picture represents the complexity of the exercise. And there's a problem though, because to do that in reality, you need quite some evidence. To calculate burden of disease, you need models and those response relationships available, numbers that you can use and do modeling with. So in the end, and very often the case, is that these exercises are restricted to the pathways and the risk factors for which you can do the estimation of burden of disease. And this is rather typical. You tend to look at only a part of the picture, driven by the available evidence and available data. This is not only in the hypothetical example. This is an example from a global estimate of burden of disease, published recently by the Lancet Commission on Pollution and Health. These are global estimates comparing different sources of global estimates of burden of disease. For air pollution, you see it dominates the picture, much less for water, occupational, and soil chemical and metal global impacts. This picture shows that the various sources of assessment tend to be consistent. That's very good. But the authors also produce this graph that indicates that our burden of disease estimates at the global level are, in fact, they correspond to the blue top of that triangle, and it is, you can do burden of disease and impact assessment in this way for those mechanisms for which you have well-characterized health effects and well-studied pollutants. The zone 2 and zone 3 are not in the picture. They refer to emerging but still unquantified health effects or inadequately characterized health effects for which we can do that. I would also add that there might be more to that because, I don't know, if through some chemical contamination we screw up insects, pollinating insects, there would be very large health impacts, indirect, but of very big magnitude, certainly. So clearly, these estimates are always tend to look at a partial picture, a part of the picture. Sorry. In any case, on a more positive note, these estimates can be, these exercises can be undertaken in many ways. We in WHO, we are in our expert community, we work with people using the freeware software, the R package, which it's rather complex, but it can really take care of all these statistics. It's also it benefits from contributions from the community, and there are dedicated libraries on HIA. With a couple of days of initial investment, and we do this often in workshops, you can get started and use R for this sort of very quantitatively based impact assessment. The same goes for GIS. Something like QGIS is a free available software that we use for this kind of and promote for this kind of assessments. So that was the kind of logical, as I say, rather hypothetical sequence for this analytical HIA. There is, however, a possible different type of approach, different in flavor, which we, again, for the sake of this seminar, we call inclusive HIA. And it starts with, the overall idea is to engage in the decision-making process rather than answering a certain question: how much is the predicted impact of a facility? The health community gets in a very early stage, working with framing really the question and asking, for example, why? Is it really, do we need this kind of facility? What options are being considered for the issue here, the waste management? How can such a facility be made more health friendly? Whose health is mainly affected? You see, in the previous example, it's easy to lose track of a very important dimension, which is the one of health equity. And here, in this kind of approach, is put right at the center of the discussion. Can adverse impacts be mitigated somehow? So all of this requires, of course, a very active involvement of stakeholders. Those questions, the questions above, that sort of questions, require really some form of a strong form of participation and negotiation, where health is at the table from the very early stages. And at some point, certainly all of the above machinery comes in, where you have to provide evidence, assess the impacts, and use all of that sequence to promote more health-friendly design of implementation and options. So this inclusive HIA, it sounds like a rather complicated process. It is, but the good news is that since at least 20, 25 years or so, the methodology is established. It's not as clear-cut, perhaps, as the one on terminal disease. So these various stages, screening, scoping, etc., we will not go into that, but they provide a structure for this kind of approach. And for each of them, there are tools and resources for implementation. In essence, in the previous example, we looked closely at the appraisal stage, the quantification of impact. So health impact assessment, this is the kind of standard definition that we use, a combination of procedures, methods, and tools by which a policy, program, or project may be judged as to its potential effects on health and the distribution of those effects. I underline words like judged, which evokes some form of expert role, and the distribution of effects. So HIA, I mean, it's often described as a tool for this kind of for cross-sectoral work, for implementation of health and all policies, and its various definitions and the flavors, whole of government approach, whole of society approach. Tool is probably a bit of a restrictive word. It's more a broad approach involving, as the definition says, procedures, methods, and tools. So we in this brief overview, I refer to these two types. I'm oversimplifying, but two types of main HIAs that in WHO, for example, and many other places, we try to undertake and assist our member states and regions and cities with. So this analytical HIA, that the first one I refer to, it's one where the question is really how large is the risk or the impact of a certain thing, like the waste facility. On the other hand, you can start with the question. The initial question could be more like, what's the most health-friendly decision that we can collectively take? On the left, it's analytical, and it's an expert job. You need modelers, you need various expertise from toxicology to epidemiology. It's driven by the available evidence. The inclusive HIA is more driven by the priority questions. It requires a very active role from stakeholders. The analytical HIA relies on rigorous methodology, while inclusive HIA, and I'm borrowing here about terminology from an area, a very interesting area of work called post-normal science. For those who are interested, it's a very brilliant body of literature. Inclusive HIA operates deliberately, I would say, in imperfection. Analytical HIA relies on considering counterfactuals, scenarios well described, while inclusive identifies and explores available options, policy options. Analytical HIA tends to have high specificity and low sensitivity, and with that I mean that it retains the outcomes for which you have a high degree of confidence on, the estimates that you can defend with a high level of evidence, and not discard, but kind of put in second row outcomes with a lower degree of less solid type of underlying evidence. Inclusive HIA tends perhaps to do the opposite of being inclusive. You bring in more. In some cases, you might lose on specificity. Analytical HIA produces results in a product. You can have papers doing, the burden of disease assessments, or the local assessments as well are self-contained objects. Inclusive HIA has more to do with the process, and its value and measure of success is more in the policy outcome of all of that. Analytical HIA requires typically more data and more evidence, demand for more evidence, while inclusive HIA, the emphasis being on action is less natural to lead into, less naturally leads to that sort of request. Very important difference, I think, is, especially for people engaged in public health, is the role of experts and ourselves. I mean, analytical HIA is an expert exercise. Typically, those in the HIA, there is a separation. The experts provide the the more factual part, the data, the solid evidence, and there's a tendency to say, okay, this is the information, now the policy process has to take that into account and make a decision. Inclusive HIA tends to put everybody together somehow, and again, borrowing from post-normal science vocabulary, relies on something which is referred to as community of peers. So experts become, in reality, one of the stakeholders, with their own values and judgment. So the word judgment was used before, and it's really key here. And finally, there's also some deep ethical type of difference, underlying distinction between different ethical frameworks that we don't have time to go into, but they also produce some rather important difference in this type of approaches. So to conclude my part, and then I'll hand over to Julia. In general, and this applies to all of the above, HIA intends to inform a decision. That's the reason why you do HIA. It's based on a holistic view of health. It has to be. It is concerned with health inequalities, even though, as I said, in some cases you might lose track of them. Typically, you start from something which is not health related, waste facility, or there's a lot of work in transport, in many fields, not all, but the starting point is a non-health issue, and that's why it's an important tools and resources for cross-sectoral work. There are standardized processes and methodologies, so there is this rather sequential view of things that the aspiration is to make these processes as structured as possible. It focuses on evidence, but in a sort of contextualized way, where the evidence is really used in the policy relevant way. And as I mentioned also, it takes into account both a positive and negative effects, with a tendency from public health people and environmental especially to focus on negatives, but very important to consider positives as well. So all of this up to now has been rather general, I recognize that, and tools are not as easily identifiable, like for you saw RQ Plus in these seminars, you saw heat for transport, you saw the climate change tool for costs, the assessment of health-related costs. But now Julia will take over and present to you some of the resources that we and others have been developing to really support people interested to do HIA on the ground. So I'll pass it over to you, Julia.
Okay, hello everybody. So what you have heard by now is more or less mainly focusing on the lowest level, on the project level, with the example Marco gave to you. But in fact, health impact assessment, as you could see in the broad definition, can be applied to the different levels we have in a policy, on a policy or strategic level, on a plan level, or on a program level. So you also have to see then the higher you go in these levels, that the less you have the exact data maybe at hand. So this then gets really a more inclusive HIA and less analytical often. And the important thing here is also that the HIA really can be used to link to such a policy process. So you see on the left side the policy cycle, where you have a generic problem that the policy wants to solve, and then they're gonna define a strategy how to do this. And exactly there is the point where the HIA can and should feed into. So importantly, it should get into the whole policy cycle at an early stage to be able to influence the decision makers making. Otherwise, you have a nice analysis, but yeah, nobody in the policy will take over the decision there. And as you know, we here are mainly focusing on the environment and health area. So while health impact assessment, unfortunately, by now is not a mandatory process. We have, I think, in our region 2 countries in which HIA is a mandatory process, which is in Lithuania and in Slovakia. And then we have a few regions which make HIA as a mandatory process. For example, next year it will come into force in Wales, and then we have in Spain, Andalusia, who have some mandatory HIA applications. But otherwise, all the HIAs that you see are voluntary. Meanwhile, on the other hand, we have environmental assessments. They have a similar process, as you could see in the HIA, and they are almost worldwide legally binding processes. So, and in all of the environmental assessments, health is always mentioned as one of the reasons why you have to undertake an environmental assessment. So for us, these environmental assessments are a big door opener. And again, here we try to push that health people and health professionals get into the process, and especially get into the process at an early stage and not only when the assessment is going on. Yeah, because as you heard already, we hope through this to avert unnecessary health burden. So what are health impact assessments, strategic environmental assessments, and environmental impact assessments? How do they link together? Well, on the one hand, you have the strategic environmental assessment, which you saw in the pyramid more on the policy plan and program level. There is the question, why should a project or a policy put in place, if it should be put in place, and then you go more to the project level, where it should be placed, like, for example, the dump site, and how should then the dump site look at. And this is then what the EIA mostly looks at. So the strategic environmental assessment is more on the broader frame, and the environmental impact assessment is more on the project side. The health impact assessment instead is able to cover all the different levels. And for both, especially in our European region, we have really strong legally binding approaches. On the one hand, for the still 28 member states of the European Union, there are directives in place. And then beyond that, we have from the UNECE a convention on environmental impact assessment in transboundary circumstances. And then we have a protocol on strategic environmental assessments, which exactly asks for the involvement of health professionals in the assessment. So usually environmental assessments do consider health determinants, but it's really more on the environmental determinants, as you have seen before. So we try to open it a bit broader and also to make it more, for example, bring in the equality, health equality issues in there. And then the health assessment can be either a chapter within the big proposal or a standalone. So what exactly is it what we do here at WHO in our center? We do a lot of networking, we compile resources, we try to develop tools, but as you see, it's a very broad area, so the tools we have here in the office are then simply for specific areas like the Q+. So we have a lot of publications by now out there where we support, on the one hand, our member states through different workshops. We have some publications giving an overview of the different impact assessment types, and so on. And then since we have our webpage, of course, where you can download all this information. And then since last year, we have together with the University of Liverpool and our WHO collaborating Center on Impact Assessment, Health and Impact Assessment, we have developed the so-called Impact Hub. What it provides is, or what we aim at, is to have a platform where, on the one hand, we can upload case studies, guidelines, information on trainings, and we also want to develop a glossary so that is open for everybody to look up, to upload even their own case studies when they think it's worth it, and then to have a deposit there where people can look up and get information. How do we do HIA? How do we look into health in environmental assessments? So the aim is to join the two worlds of health impact assessment and environmental assessments together. And one example are the case studies we are collecting there. Importantly, there is no qualitative review on it. For now, it's simply just a deposit. So you can look up resources and yeah, we still need input to fill in, but this is how it would look. You can choose a location, the language, so we are open for all languages. That's the fact. Also, it should be open for all sectors. The level could be policy or it could be a project level. And once you have chosen the case study that is interesting for you, you get a template where a short description of this case study is there. And then hopefully you can also download the main report if you want to go into more details. And what we are now working on, which is work in progress, is to develop a tool or a review sheet for HIA reports. Exactly that you can see and go through such reports and say, this is an interesting one in the screening phase. They did a very good job, so you can have some qualitative characteristics in the sheet to see what you can do and how you can evaluate an HIA if it really does the job it should do. And that is what we have at the moment here.
Okay, so we are done. Thank you very much, and we are clearly.
Thank you.
Questions are most welcome. Go with you, Francesco.
Yes, thank you very much, Marco, and thank you very much also Julia Novacki, and apologies for not introducing you earlier. But thank you very much also for your contribution to the presentations. I would like now to ask our many participants in this webinar to ask for questions through the chat. So if you can please write down your questions in the chat. In the meantime, while you think for questions for our two presenters, we got one question, I think it was for you, Marco, about the circular diagram that you presented in one of your first slides, with micro and micro effects on health and well-being, and they were wondering whether there was a source for that. They were interested in knowing the source of this diagram that you presented. So this is one of the questions. And I also would like to ask something to you. Well, it was very interesting to see the effects that you presented, and many of them of a new project could be negative, but also fortunately you mentioned also the positive side that has also to be taken into consideration. I guess this is why new projects are carried out. But I also understand that in health impact assessment you need to deal with a part which is the unknown. And then when you deal with that, I would like to understand a little bit more about the communication and how to engage with stakeholders. And I recall here that we had a specific workshop in Italy on this, on communicating the risk. And I would like to know whether, while conducting health impact assessment, there are specific indications or advice that you can give in terms of how to communicate with lay audience, so not those who are technical experts in the field, and so how to manage this uncertainty and sometimes also the unknown effects on health that a new project might take. So if you could reply to these questions in the meantime, and please, participants, don't be shy, ask questions through the chat. Over to you, Marco and Julia.
Okay, well, we started with the two very important questions, and not easy, of course. The first one on sources of those graphs I guess the reference was to the example of the waste facility and the burden of disease. That was, the size, as I mentioned, the size of those boxes, the circles, was hypothetical. The source is the evidence available on health effects of waste facilities. We did quite a bit of work over the years on that, and it led to the Ostrava inclusion in Ostrava. So the evidences I referred to on the health effects of air, water, soil, food emissions, as well as the odors and annoyance. There is literature on that. We published also some review. But as I mentioned, in many cases, the evidence does not allow a quantitative estimates. So the sources for those graphs are I would say that the body of literature on health effects of typically of living near waste processing facilities. As to the second question, Francesco, it's of course a very big one. How to deal with uncertainty, unknown, how to communicate. One key issue is to, of course, do so from the beginning, ensure that there is common understanding with all those involved on the goals, on the limitations, because as I mentioned, it's important to be clear about where you put yourself in the broad scheme of things. You refer to the work we did some years ago on risk communication in environment and health, and some key points are still valid of that report that we made, and maybe the reference could be circulated through your channel. Essentially, I think it's always very important to acknowledge the uncertainty and limitations. Do not pretend that these estimates are really the final word. Most of the times, always I would say, they come with rather substantial uncertainties, and one has to be clear about those. Sounds obvious, but in some cases it's not done, and these numbers are given out as very uncontroversial, and maybe you have the press making big headlines with them. That happens even if you put disclaimers, but in any case, it's important to be clear about those. And it's a very long, very big issue. There are several many experts working on this, and in our publication we try to put together a handful of sort of take-home messages for how to deal with that, which there's no time to go into that now, but it's an extremely important area of work.
Thank you very much, Marco. We can also circulate that publication again when I send the link with the recording of this webinar. We had another question. The speakers mentioned that Lithuania and Slovakia have implemented non-voluntary health impact assessment. Do you have information for what kinds of projects are included under these rules and what the successes and challenges have been so far? And this is also a more general question, maybe if I can add on that, like yes, in terms of like general successes of challenges or like failures that usually you face when you undertake health impact assessment, do you have any general advice that you can give? Also considering this interesting initiative of the impact hub that you are populating with different experiences. So what kind of general considerations are you drawing out of them?
Okay, regarding Slovakia and Lithuania, well, in Lithuania it is very much linked to the environmental assessment. So because when they had the transition to the EU legislation, they put in place that also whenever there is done a major investment in which has to undergo an environmental assessment, also some health impact assessment has to be done. In Slovakia, as far as I know, it's not so much bound to the environmental assessment per se, but if I'm not mistaken, the public health authorities can request that a health impact assessment on different projects has to be undertaken. I think the biggest challenges in both countries is the training. So both countries had in place some certification. So in Lithuania, before you can do a health impact assessment, you have to undergo some mandatory training, and then you get a certificate for this. And I think a similar thing is in place in Slovakia. And in fact, that is one of the main issues, to keep up these trainings and then also to build up the knowledge in the health authorities to know how to do a health impact assessment and also to how to get involved with the other sectors, because that's also the main challenge we have with the hub, as you say, because we still have these silos between the health sector and the environmental sectors. So nicely enough, our collaborating center is sitting in the planning department at the University of Liverpool, so there are no health experts, and we are on the other side, the health experts. So through this already we try to bring together the two different worlds, but that is also the biggest challenge. So if you look at the hub, you don't see that many case studies there. So we're always trying to push, please upload more case studies and so on. So it's still the main challenge is breaking the silos, and not necessarily in the environmental area, but mainly in the health area also.
Thank you very much, Julia. And actually, the importance of sharing case studies, this is so important for our network, Regions for Health Network, and this is what we try to do, to document case studies, to make them available to others, because really by seeing what others are doing, you can trigger, at least in your mind, and see what you can do similarly in your own context. We have two more questions. One is more general, like regarding inclusive assessment, and I really liked that slide with analytical inclusive assessment. That was very interesting. Regarding inclusive assessment, HIA on the ground, can you please give further examples of good practice? Again, the importance of like case studies on that. And then we have also a question from a colleague from Kenya. Very welcome. What are the key indicators in health impact assessment? If you have like key clusters of indicators that you can give, or
on the first question, I think we can both try to provide examples. I mean, it's not easy to pick further example. Good practices are happening everywhere. The things that spring to mind, and we had it in the slides, also because there was waste and been a bit of a theme, is the work that the colleagues in Wales are doing and have been doing for a while, and it's a very strong powerhouse of HAA in Europe, I would say. It's often a reference. UK has been, in fact, a bit of cradle, I would say, of HAA over the years, but certainly not only there, because there have been examples in Northern Europe, We currently do some work with the colleagues in Portugal, where there is interest on contaminated sites, on some nutrition-related projects. And over the years, there's been a lot of activities. And I'm trying to think at the regional level. I want to mention a large project a few years ago that the region Emilia-Romagna of Italy did on its waste policy on incinerators, essentially. And that's an example of a major undertaking, of a multi-year, very large project involving all sorts of experts and policy. It was called Monitor. If someone wants to look it up, will find quickly papers and reports. Julia, you want to add something?
Well, if you go for a search on the internet, you will find a lot of HIAs which are from the United States or from Canada. One of the classic ones there is from an oil company in the mining project, Mackenzie area. That is always one which is there, but you always have to keep in mind that they work under quite some different legislation than we do here in Europe. So many come from the UK, like Marco mentioned, Wales.
One area that I would like to mention, I think it's a special area, I would say, is transport. There's a lot of very good HIAs of transport, and this is due to, well, the long tradition. First of all, it's a long time that lots of people have been working on transport and health. It's due to the availability of very strong underlying evidence. We know a lot, of course, about air pollution, which is always the main chapter in these kind of things. But things like noise or road injuries and effects through, including psychosocial effects, contribution to climate change, they're all, they come with rather or very strong evidence on the existence and extent of the health effects. So it's an area where the sort of quantitative part is very solid. You can attach costs to it. Physical activities also nowadays are very, very important pathway to health. So these assessments in transport, and they are from very small level projects like small changes in infrastructure to broad policies, are very instructive and they've been influential in policy decisions.
Thank you. I have quite a number of questions here, and I would like to ask you to be brief now in the answer, because we are towards the closure. Asking whether there are still questions, please to write them through the chat. We have one about HIA and legal framework to oblige to do it. What about policy commitment, or maybe political commitment? I don't know what is meant by, if it was policy or political, in any case. That is one of the questions. The other one, and this is a challenging one for you, I guess. In case one needs to perform a HIA, do you support practically with expertise when one plans to perform HIA? One can discuss it with WHO experts. Well, maybe Marco now and Julia, you're going to have long nights then. And does the tools apply to a broad issue like climate change? How to start? And then, what advice would you give the country that has no experience regarding HIA? May all the data, or maybe not all the data, are available at the beginning? So what are the minimum list of data we, public health sector, need in order to do HIA? So quite complex questions now. and the time is short. So for short answers.
We also left behind a question from Kenya. I'm sorry. I was not very clear about indicators, but maybe it goes together with some of these other questions about when you have no data or what's the minimum level. Maybe some of these questions refer to the same situation, which is, my understanding is, you see the value, but you don't really know where to start, and you don't know whether you have enough data. Well, my general comment here, and it's a bit difficult to keep at this general level in short time, is, however, that any form of HIA, even though based on very limited data or sparse data or whatever, is better than no HIA. So I wouldn't certainly even try to describe a minimum level. As long as there are some health-minded people willing to look at the health side of a new policy or a new project, that's going to be of value. And some data will eventually come up as soon as you engage, I think. Otherwise, we have things that have been happening for many years. You have major developments in transport, industry, energy, which change the face of the planet or your community, and nobody in the health sector is involved. So that's one of the main issues. I mean, HIA is really a tool, as a minimum, to put health-minded people at the table, and that's already an HIA in itself. So, of course, when you have data, it's easier to make your case, but if you don't, you can still make a case for health. That's, I think, the most important thing. And of course, for climate, climate is a good example of the question of climate change, of something which, of course, has phenomenal health implications. Over the years, and now I think the health community did a very good job about providing data on the health impacts of climate. We're probably still looking at a partial picture because potentially so large, but the health community came to the table, and now climate change is indeed a very central area for HIA as well. And now the very difficult question about to what extent can we provide support for people wanting to do HIA? Well, Julia, why don't you answer to that?
Well, in general, we can at least put you to the right information, or to some information we have gathered. That's for sure. If we can go with you along an HIA, we are doing it at the moment with Portugal, but this then needs the official contract between WHO and the Portuguese Health Ministry. So that is a bit more complicated. But in general, at least we can put you, give you some information, and then there are these, exactly the hub, the Impacts Hub out there. There are other web pages. There is an HIA mailing list where exactly such questions always can be asked, and then you get answered from the HIA community. So all these things are out there, so at least we can connect you with things like this.
And certainly everybody is most welcome to contact us, and we're happy to try and help out as much as we can.
Thank you very much for your the availability of both of you. Just one mini question from my side for maybe 30 seconds reply. For each of the two softwares that you briefly introduced, R and QGIS, if you can say just a couple of words more about them, how they can be used and to what extent they are tools available for our participants.
Those are very complete software packages, freely available. You download them and install them, and it's big programs. If you start from there are also tutorials, etc. As I mentioned, in both cases, we run 2-day workshops introduce to the use of these packages in health impact assessment. It's not something that if you start from zero, it can be a little discouraging because it's a lot. But certainly, once you get once you make the investment for getting started, which requires an investment and some time and attention, then the powerful is enormous. The communities that you can, they contribute libraries of functions for health-related issues, and it's a very professional type of resource that can indeed help the quantitative part of NHA.
Thank you very much. I think that we are towards the end of our webinar. I would like to thank once more our speakers, Marco Martuzzi and Giulia Novacki, for their availability to take part in this webinar, for the interesting presentations. The PowerPoint will be made available together with the recording of this webinar in a couple of days. I would like also to thank Andrea Bertola here at my side for the technical support, always very much appreciated. And I would like to ask all of you participants to this webinar to send me separately later feedback on this series of webinars, so not only on this one, but in general to the idea of the webinars, whether you thought it was a good idea, whether you think you have suggestions for the future. We already have some ideas on other topics that we would like to propose to our Regions for Health Network members, like around equity, as next year, 2019, will be a big year for equity with a new important report, equity status report for the WHO European region, and many initiatives around that. So if you have suggestions for topics, if you have feedback on the format of these webinars, and if you like the idea, please let me know. I will be very happy to read your emails. And once again, thanks to our speakers. It was extremely interesting for me also to learn more about the health impact assessment, and I know now to whom I can turn in case I need to run a health impact assessment. Thank you very much for your availability. And given that we will not have other webinars until the beginning of next year, I would like to wish you all pleasant and relaxing and warm festivities. Thank you very much, and see you at the next opportunity. Thank you very much. Thank you.
Thank you.
Bye.
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 Thank you.